Good morning. My name is Joanna Wolf. I'm Vice President for Advancement and University Relations at UHD, and I want to welcome everyone, both those of you who are here in person and those of you who are joining us virtually for this morning's town hall. This is the third town hall providing details about UHD's preparations to return to campus safely for the fall 2021 semester. There's another town hall scheduled for our students this evening. So first, I want to tell you the format for this morning. President Blanchard is going to have a few opening remarks for us. There'll be a presentation by Associate Vice President for Academic Affairs, Michelle Masali, regarding our preparations, and then followed by a Q&A with university leadership. We have 8 of our university leadership joining us this morning for the Q&A. Questions have been provided during the registration process. Some of you provided questions then. Those in the audience will have the opportunity to ask questions this morning, and then those watching virtually can use the chat on your Zoom to ask questions. In order to make really good use of our time together, we're going to navigate between those platforms to provide answers to your questions across a broad array of your questions and concerns about our preparations. But we will be focusing on our campus transition and our COVID-19 preparations for the fall. So without further ado, I want to introduce President Blanchard. Thank you.
Good morning, everyone, and thank you very much, Vice President Wolf. And thank all of you for participating in today's very important town hall. It seemed as if this moment would perhaps never arrive. But the start of the fall semester is now upon us, and it's a pivotal moment for the University of Houston downtown. Students will be returning to campus very soon and following more than a year of online and hybrid learning. For many of these students, it should be no secret, this will be their very first time navigating a college setting, and not just any college setting, but our university. And we must also remember that our second-year students, many of them have never even put foot on this campus yet, but they will. And the reality is that it's really imperative that we're ready to support all of these students, be they returning students or new, giving them all the support that they need when they arrive here. This will include providing directions to classrooms and various offices, making sure that they know where to park, if they can find a parking spot, and where to catch the shuttles, and more importantly, letting them know just clearly that we're here for them, genuinely. Let's remind students why they chose the University of Houston downtown, and that they are now part of our university family. But let's do so with safety in mind. Yes, we're still in the midst of an unprecedented and unpredictable pandemic, and everyone must continue to do their respective parts to help to ensure the success and the safety of our students and our faculty and staff, while being mindful of our own individual personal health. I'd ask that you please consider a mix of both courtesy and caution. Use your best judgment when coming to campus and interacting with coworkers and students. If you don't feel well, alert your supervisor, consult with your physician, and stay home. As you're aware, the University of Houston downtown is a state institution, and it is required, we are required, to follow guidance from the Texas governor. With that in mind, the university cannot mandate masks on campus, nor can we require vaccinations. As the president of this university, however, I want to make it very clear that I highly encourage all of us to take all of the precautionary steps before the start of this semester. If you've not yet been vaccinated, you can do so on your own at any place here in Houston, or you're certainly invited right here on this campus on August 26th, when we will partner with HEB to provide vaccinations in our Welcome Center. Information on the ability to be able to take advantage of this vaccination is available on our homepage, UHD homepage, and you'll receive email reminders as well on this event, along with an incentive program to really get the entire UHD campus vaccinated. Although UHD can't require masks, as you've heard me mention earlier, we are still a mask-friendly university. You are encouraged to certainly wear protective face coverings if that's your preference. And as a reminder, we also are providing free COVID-19 testing next to the Student Life Center right here on campus, Monday through Friday, 9 a.m. to 5 p.m., free of charge. Want to make sure that everyone takes full advantage of that opportunity that we have right under our noses. Today, however, you should make use of some of the most valuable resources that we have on campus. Our people. As you heard Vice President Wolf mention earlier, we have UHD's leadership team here, ready, available to answer any questions that you might have, but also to allay any anxieties that you might have as we all prepare to be here on the University of Houston downtown campus. I can say to you that this is my 5th month here, and certainly I have exercised every measure of precaution possible. I am fully vaccinated, and certainly encourage everyone else to be fully vaccinated, but I'm also mindful of the care of others, as you will see many of my colleagues when they come before us today. So keep in mind that it really is the ability for us to make personal choices to not only protect ourselves, but also to protect others. With that in mind, I'd like to turn everything over now to Dr. Michelle Masali, Assistant Vice President of Planning and Curriculum, who will offer us an overview of the status of our campus and university operations. Please welcome Dr. Masali.
Thank you, President Blanchard. Good morning, everybody. I'm happy to be here. While I'm the AVP of Programming and Curriculum, I'm here primarily in my capacity as chair of the COVID-19 task force. We've been meeting regularly and communicating with Cabinet and trying to guide the decisions and reflect the concerns and inquiries and issues that are arising on a daily basis on campus. So I'll be going through a slideshow, and I will be going fairly quickly through some of it. Some of it is not brand new information, but we know that people are joining the conversation at different points, and so we want to make sure that we are covering all of it. Certainly, we can come back to some of these slides during question and answer if we need to. All right, so first, our campus enhancements reminders. We have done a lot to make this campus safe, and we want you to be aware that we are constantly trying to address those issues. We have door openers, we have hand sanitizer, we have enhanced cleaning, and for the classrooms particularly, we draw attention to the fact that we are doing a full fogging every evening for all classrooms that are scheduled for usage. We have air filters being routinely replaced, air handlers, plexiglass barriers, and PPE is available for students, faculty, and staff upon request. For faculty and staff, we encourage you to go through your unit business administrators so that we can handle that efficiently. In terms of service and events, we have our parking system fully operational and back up for our regular operations for FY22. So if you have questions, certainly go to the parking website, and we have some basic information here. Shuttle buses will be operating at full capacity. We have multiple routes, and they are working all day into the evening. You also can download a Ride Systems app to track what's going on with those. Campus dining services, we have a full array of dining services. This is effective August 23rd, 2021. So please make sure that you are taking advantage of this. If you are on campus, there's mobile and in-person ordering for several of them. A couple of them have only in-person ordering. So double check on all of those, and these slides will also be available to you, as well as the recording at the end of this session. The Boost mobile ordering app will make your life easier, so if you haven't downloaded it and you're willing to do so, please consider doing that. Events and meetings. So for indoor gatherings and events, as we had announced, reservations through university events, the food options and spacing may be available as per pre-COVID operations. However, we are seeking and setting up a system for approvals for all large-scale events, 50-plus attendees, and that will need administrative signature, dean or VP, and a safety review prior to engagement with the events planning. So even if you're not going through university relations, if your unit has a space or you're planning a large-scale event, we will need to have those approvals in place, and we'll be offering guidance as needed. All unit leaders, sorry, in terms of meeting options, we really ask all unit leaders to consider a variety of criteria, including the type of event, the type of work that needs to get done, the number of participants, the room spaces available, and the types of safety precautions that are possible as you make those decisions. We know that there are a lot of options out there. We have large and small meetings, so just take into account a number of variables when you make those decisions. If you have any questions, our events team is always available to answer them. Commencement. We have commencement. We're very excited to allow our graduates who want to be able to walk. We know it has been a long wait. So we will be at NRG on Saturday, August 14th in 2 ceremonies at 9 a.m. and 2 p.m. according to college. We want to make sure that everybody understands that we are social distancing at this event. So all participants will be seated with 4-foot social distancing, students, platform party, everybody. And then students are limited in the number of guests they can have. They have been required to request reservations. When they request those through the system, they will be socially distanced in groups as appropriate. So we are doing our best to make sure that we are creating an environment where people will feel comfortable. We also are planning a week of welcome. Our student affairs areas are very busy planning to welcome our students back. So this is just a quick snapshot of events. We certainly encourage you to go to the website for more details. State requirements. As President Blanchard mentioned, and as we know, we are a state entity, and therefore we are bound by governor's orders. In particular, we draw attention to Executive Order 38 from last week. This order prohibits UHD from requiring students and employees to show proof of vaccination and reveal private health information. And the order also states that no government agency can require people to wear a face covering. So we can no longer mandate wearing of face coverings in any campus spaces or at UHD-sponsored events. But we remember that everybody is welcome to wear a face mask. We are mask friendly. Failure to comply with this can lead to a state fine. So again, remembering that as employees, we are bound by these kinds of restrictions. However, we also know that there are things that we can do. So this is where we want everybody to take their own personal actions. Get vaccinated. We encourage everybody to do so. As the president mentioned, we are offering vaccines ourselves on August 26th and September 17th, but there's certainly availability all over the city. Getting tested, we have our COVID testing center, 9 to 5. It is free. It is a shallow nasal swab, so I know that there's concern about how that's getting done. I have not gone, but I plan to do so this week. So please understand that you can sign up online. Nothing will be reported to UHD unless you go through the reporting system at UHD. Workplace accommodations remain available, so please consider whether you have an ADA or FMLA appropriate accommodation requirement and talk to our employment services. What can you do as an individual? There are a number of steps that you can take for yourself and for others. Get the vaccine. Conduct a daily self-health check. Wear a face covering. According to the Texas Department of State Health Services, vaccinated or not, wearing a mask in indoor public spaces can help protect you and everyone. Socially distance yourself where you have space. Wash your hands and use the sanitizers. Respect the space and mask-wearing choices of others. And as we have learned in the past year, remaining flexible, responsive, and communicative is critical to our success. In terms of reporting, reporting requirements and return to campus requirements have essentially remained the same. We have a lot of information on our website, including the forms and the return to campus form. So all of the forms that we submit are reviewed by the contact tracing team. They are very active and on top of that communication. They are authorized to request information on vaccination status for public health purposes as part of their process to determine appropriate next steps. Anybody who is asked to quarantine should not come to campus until they apply for and receive written approval via the return to campus form. This is all spelled out, and we have additional details specific to the staff and faculty processes. If you are exposed as a staff member, you want to leave campus immediately and contact your supervisor as soon as possible. Complete the form. There's an exposure form. If you're vaccinated, return to work the following day. If you are unvaccinated, you should quarantine and follow directions from the contact tracing team. If you're not sick and the supervisor determines work continuity is needed and can be performed, then we can approve remote work. If the work cannot be performed satisfactorily or you are sick, then you would submit a leave request for the period of quarantine. And then upon testing negative, you would submit that proof to return. COVID positive reporting. So this is if you are COVID positive. Again, you would leave campus and contact your supervisor, complete the reporting diagnosis form, submit proof of diagnosis within 48 hours, quarantine as directed, submit sick leave requests for the period of quarantine. Remote work is not possible in those cases, and submit proof of testing negative after the quarantine period is over. For faculty, processes are similar. Leave campus immediately, contact your department chair if you believe that you have been exposed. Complete an exposure form. If you're vaccinated, you can return to work. If you are unvaccinated, you should quarantine and follow directions, and discuss continuity of instruction plan with the department chair. This is a really important component of the process, and we will be working with the departments to make that clear. And then submit proof of testing negative after the quarantine is over. If faculty report positive COVID, again, leaving campus immediately, contacting the department chair as soon as possible, reporting diagnosis form completion, submitting proof of the diagnosis, quarantining, and discussing continuity of instruction plan with the department chair, and then proof of testing negative. So these are all very clearly spelled out on the website. We are working always to enhance that. So if you have questions and you're not able to find something on the website, you can contact our contact tracing team just for information. Classroom diagnosis. We know that this is a question that is out there. What happens if something happens in the classroom? The contact tracing team will be involved because people will be reporting through the forms, and they will be able to give guidance as the cases arise. But our goal is to minimize disruption while maximizing safety, and that's a delicate balance, and we will be working with everybody. Emergency management, the Office of the Provost, will work with faculty and department chairs to determine an appropriate continuity of instruction plan and communicate decisions to the classes if there will be changes to them. We know that this is incredibly important to make sure that everybody knows what's happening and when. I want to give a shout out to the COVID task force members. There are a lot of really great people representing all the constituencies on campus, as I said, meeting regularly and doing the hard work of trying to understand where we can go and what we can do to help everybody improve our experience for our students, the staff, and our faculty. We're going to start with a few FAQs, but then right after this, we will move into the general question and answer period. So if you have them, as you know, you can submit them online. Can the university require the COVID-19 vaccine? As we've said several times, the governor's executive order expressly prohibits this. We cannot ask. So as a supervisor, may I ask? No. Per the executive order 38, you should not ask whether any employee has had the vaccine. Will I know if coworkers or students are vaccinated? Can I or should I ask? No. We cannot ask for personal health information or for vaccine status. You would only know if people share that with you voluntarily. Can I require or invite only vaccinated employees to attend in-person meetings? No. We cannot limit in-person meetings to those that are vaccinated. Do I still need to wear a face covering and practice social distancing on campus if I've received the vaccine? Face coverings or masks are no longer required per the governor's order. For those who prefer to wear face coverings and/or masks, they can certainly continue to do so. We also encourage students, faculty, and staff to get vaccinated. This is a very clear recommendation for everyone. Do I still have to observe social distancing on campus? UHD is no longer requiring social distancing anywhere on campus, including in classrooms. However, we continue to encourage everyone to pay attention to their safety and to practice personal accountability. May I require students to meet remotely? Taking into account student demand, faculty and staff are expected to offer in-person office hours and meetings to students. And we are at the open question phase, so I will turn it back over to Joanna Wolf to guide that conversation.
Dr. Tamez, would you begin with our introductions?
Yes, Dr. Meritza Tamez, Dean of Students.
Hussein Shiroki, Associate VP for Information Technology.
Lauren Blanchard, President.
Daniel Villanueva, Vice President for Enrollment Management.
Mary Torres, Director of University Business Services.
Hi, Jennifer Bloom with the Office of General Counsel.
Yvonne Montalbano, Vice President for Employment Services and Operations.
Jerry Johnson, Associate Vice President for Faculty, Research, and Sponsored Programs. Marty Baylor, Interim VP for Administration and Finance.
Jim Rylick, Assistant Vice President, Facilities Management.
Cynthia Vargas, Director of Emergency Management.
Michelle Masali, AVP Programming and Curriculum.
Thank you. So as I said earlier, for those of you who are here in person, there are microphones set up. If you want to walk down to the microphone to ask your question, we'll be taking some of the questions that were presented when you registered, and then have some questions coming in through the Q&A. So Cynthia, if I could ask you to answer this first question. If a COVID case occurs in a face-to-face class, what is the protocol for faculty to follow?
All right, so about a year ago, we developed this flyer. I'm going to go ahead and show it to everybody. This is actually posted in every single instructional space classroom, at the lecterns, or at the professor's desk. You're also going to see these at supervisors' desks, and sometimes in some of the offices. We've made an attempt of placing them everywhere. And I really want to highlight this flyer because it lists 8 steps that we want you to take, and if possible, in order. Go through them just systematically, and when you get to step 6, that's where you request your cleanup, right? And that's when we're here on campus and we feel threatened, we feel that space needs to be cleaned up. That's really the critical piece. That's going to direct you to this QR code at the bottom. Literally scan it with your phone, fill out that survey. It's about 3 or 4 questions, and submit it. That's going to hit me. It's going to hit the facilities management group, the police department group, leadership, the registrar's office, and provost. You're going to get the cavalry coming. We're going to call you right away. We're going to obtain additional information, and we're going to move you to safe locations so that we can clean up that space and get people in the right spot. And immediately the contact tracing program starts. In addition to that, if you have any questions, if you're unsure at any point, please call me. If you want a copy of the flyer and you don't have it, please email me or write to the coronavirus email address, and we'll get it to you as soon as possible.
Cynthia, as a follow-up to that, can you talk a little bit about the infection reporting process and the consequences of a positive report?
Yeah, absolutely. We set up a diagnosis, exposure form, and return to campus form, right? Collectively, these are our reporting system for COVID. Those forms don't go to a nameless mailbox. They hit me, and they hit me continuously, me and my staff. We're constantly monitoring for them. So when you submit that diagnosis form, right, because you're feeling sick with definite COVID-like symptoms, if you come up with a positive test result, right, that's the form we want you to fill out. That'll hit us. We're going to immediately respond. Within an hour or 2, you're going to get a phone call from one of us to ask you for additional details. To be honest with you, sometimes people accidentally submit it. They get a little curious, and they go on there, and before they know, they submitted it. So we're going to go ahead and validate that. With the exposure form, if you believe you've been exposed, which is you've been around somebody that's COVID positive for 15 or more minutes, and you've been within 6 feet of them, and you're not vaccinated, that constitutes an exposure. We want to know about it, and we want you to stay home for that quarantine period, that 10-day period. Submit that form. We're going to work directly with you and tailor your return to campus. Some people find out a little later that they were exposed to somebody with COVID. Some people find out right away. So the actual time that you spend around campus may vary by a day or 2 from person to person. So we're going to work directly with you on that. As far as the return to campus form, before coming back, if you've been quarantined in any capacity, please fill that out, answer the survey. That's going to give you a response as to what steps to take next. Either come to campus or stay out a few more days and contact us. So we may need to move that date because your situation may have changed, and that form is going to catch it. Again, if you're in doubt, you're not sure what to submit, let me know. Call me, contact me, email me. I would prefer that you accidentally submit it too many times than not. So when in doubt, submit it.
Thank you. I believe this question will be for Dr. Johnson. What is the plan or perhaps Dr. Blanchard, I'll let y'all determine that. What is the plan to transition back to virtual and remote work if COVID cases rise again as students and staff return to campus in the fall?
I'll start and then thank you. I'll start and then I'll ask Dr. Johnson or Dr. Masali to step in. It will be very similar to the procedures that you followed the last go round, but this time with adequate warning. We are continuing to follow all of the information, the data, not only for Harris County, but also looking very carefully across the state. And if there is going to be a need for us to move to remote learning, as we did in the fall of 2020, then certainly you will definitely be notified, and that more importantly, we'll make sure that you have all of the technology resources that you need so that it will be as smooth as possible. But in addition to that, we'll also ensure that the level of training that you will receive to ensure that this type of modality, although you've got experience at it, that we want you to continue to grow in your ability to ensure that learning is taking place as effectively as possible. So the assurance is that you will be notified in advance, in as much advance as we can provide. We're going to make sure that you have the technology that you need and that you're going to get the support through professional development as you move through in teaching these courses using the remote modality. Dr. Johnson, Dr. Masali, if you'd like to add more.
Thank you, Dr. Blanchard. I think that covers it. I know, as Dr. Blanchard mentioned, we have a lot of experience in this transitioning, fortunately or not, from the past year, and so we are confident that we will be able to do that if needed, and we will work to support all the units to do that most effectively.
Thank you. Cynthia, can you discuss about the decision to remove social distancing from campus?
Yeah, at the time, we had moved into a better place, right? This was done in the summer. As of right now, we recognize, you're asking this question because cases are rising, right? Hospitalizations are rising. Everybody's concerned, and people are scared. You know, here on campus, we share that same concern. We are watching those cases closely. We are watching as things unfold. A year ago, we resorted to some tools, right? Social distancing was one of them. Mask mandates was another one. The governor imposed that on us. But at the time, we didn't have tools that we currently do have, right? We have one of the most effective tools for dealing with a pandemic, and that's a vaccine. The governor, the Department of State Health, every single health department out there is stressing the importance of doing that. We're not there yet, folks. You know, in the state of Texas, we only have about half of our population vaccinated, and it's showing. It's showing in our current numbers. So in order to tackle this, in order to get out of this constant cycle and getting out of this, you know, just the fear of living in this pandemic world, we need to each do our part, right? We need to go get vaccinated. We each know somebody that hasn't been. You know, please, if you can, talk to that person, get them to speak to their doctor and get out there. That is our most effective means. We're using other means on campus as well. You know, we're continuing. We didn't have PP a year ago. We didn't have masks. You know, think back a year ago, folks. There were no masks. There weren't even masks available in the hospitals. Right now, there are masks everywhere. You can find them on campus here. So if you can't social distance, right, and you feel concerned, that's a tool that you have at your disposal. You just need to exercise that choice. We didn't have a whole lot of hand sanitizer, right? That just wasn't available last year, guys. Remember what the shelves looked like. It was empty. You couldn't find bleach. You couldn't find cleaning supplies. That's all available now. So as a result of having additional tools available to us, we can let go of some other ones. And in this situation, that's one of the reasons why we were able to back off from social distancing. But we are constantly monitoring, and if in the future that becomes a necessary measure, we're prepared to implement that as well as any other measures that are out there available to us.
Thank you. Jennifer, could I ask you, what advocacy measures have any leaders taken on behalf of the university to respond to state leadership regarding decisions around masks?
Sure. So the governor's order that Dr. Masali mentioned in the PowerPoint, number 38, was just issued last week. Before that time, as well as since then, university leadership has been in discussions with system leadership, as well as university leaders statewide, to talk about what we can do. The governor's order makes clear what we can't do. So now it's to brainstorm and collaborate on what we can do going forward. And one of the things that Dr. Blanchard mentioned was the vaccination incentive program. So there are different things that I think you'll hear more about that the university can do as a unit, as well as encourage everybody to take the steps of individual responsibility that Ms. Vargas has mentioned, as well as what were set up in the PowerPoint.
Thank you. Dr. Masali, with the virus spread in the community, are there any plans to lower class capacity sizes?
At this time, as we've indicated, we are monitoring conditions, but they are constantly changing, and so we don't have any current plans to lower those capacities. But as Cynthia mentioned, there are tools at our disposal, and should that become one of the options, then we would work with all of our units, particularly the department chairs and leadership, to figure out what is and is not possible in consultation with our facilities and registrar's office to determine that. But at this time, we don't have any plans to reduce the course capacities.
Thank you. Hossein, a question regarding computers. Will faculty receive computers in the event that remote work is needed again? And are there any additional opportunities for students to get access to computers?
Yes, as we did in this past year, we will continue to provide faculty with equipments they need for home, laptops, accessories, webcams, digital pads, those type of things. And as well as in support, as President mentioned, to make sure that all the faculties are able to do their teaching remotely effectively. Same thing with the students as we did this past year. We're working through the Dean of Students Office, who will continue to monitor and identify needs, including technology needs, to make sure that students are successful during fall semester, and reach out to them, provide the equipment that they need.
Dr. Tamez, did you want to add to that?
Yes, if you know of students who need technology, have them email UHD Student Affairs at uhd.edu. Again, that's UHD Student Affairs at uhd.edu.
Thank you. Tim, a couple of questions for you. Is fogging being used for high-traffic student-facing offices, such as advising?
Say that again, please.
I'm sorry. Is fogging being used for high-traffic student-facing offices, such as advising offices?
Yes, we currently clean all the areas throughout the university multiple times, and areas where there's high traffic, we will be fogging at night. And that'll be the exact same stuff that is approved by the CDC and the EPA for use on COVID.
Great, thank you. I have a couple of other questions I'm going to ask you now. Can you comment on ventilation in areas where clearly windows cannot be opened and classroom doors are closed and locked?
Our ventilation system starts up about 2 hours before anyone comes to the university. First, the outside air handler starts, which flushes all the air from the structure, and it continues to run throughout the day to the end of the day. After everyone leaves, we continue to run the ventilation to remove any contaminants from the air out. We're also in the process of installing brand new outside air handlers, which should be completed by the middle of next week. This will bring in more air into the structure, all of them, not only this one, but the College of Business, College of Public Service, and the Science and Technology building, to ensure that we meet all ASHRAE and CDC guidances for outside air.
Thank you. And a question regarding elevators and access to elevators that are operational. Can you comment on that? Sorry.
We are currently working on all our elevators right now, and we're changing our vendor, which will happen in the next few weeks, to give us a more robust elevator operations. We also have purchase orders out to renovate 6 of them right now, and we'll be starting that here as soon as the parts arrive.
Thank you. There is a question regarding the Faculty Senate resolution giving faculty the opportunity to change the modality. President Blanchard, do you want to speak to that?
Yeah, I'll speak to it in the absence of interim Vice President for Academic Affairs, Usman, who is away today. That we are in receipt of 2 resolutions from the Faculty Senate, and that we are in the process now of responding to it. Read that question to me one more time, please.
Sorry, hold on. What is the status of Faculty Senate resolution regarding giving faculty the ability to change the modality?
Yeah, and so obviously in terms of the modality piece, a lot of that, the planning for the course modalities and which courses would be offered in person versus which courses would be offered which courses would be offered in a hybrid model, as well as those courses that would be offered remotely. All of that has been planned not only with the respective departments within the colleges, but also in collaboration with the Office of Academic Affairs. So my recommendation is that certainly we don't plan to go far astray from what we already have planned. And let me just be clear about that, that we've got a strong mix of courses that are being offered on campus and in tandem with the courses that are being offered remotely. And if there is a particular circumstance of a faculty member that needs to be addressed, then certainly that can be handled through the department, the college, and then on its way up through the college. But at this point, we really do plan to adhere to what we already have in place that's established, that shows very clearly that we've got a considerable amount of courses that are being offered remotely, a considerable amount of courses that are being offered on campus, as well as a considerable amount that's being offered on a hybrid modality.
Thank you. Yvonne, are staff members required to use sick leave if they test positive for COVID-19?
Yes, if staff test positive for COVID-19, they are to quarantine, and they are to use sick leave during the period of quarantine.
Thank you.
And let me add that since they're using sick leave, they are not to work from home. They're not to work remotely, but take the time to get better and then complete the required forms for coming back to campus.
There is a question regarding social distancing at commencement. Daniel, could you speak to that, please?
Sure. We understand the concern of social distancing, and therefore you can see us on stage practicing social distancing. And although as a state institution we cannot mandate it where operable, we are able to practice it. And that certainly is one instance in which we can. We began planning commencement as early as January of last year, this past year. And so at the start of planning commencement, we worked with NRG to go ahead and plan a socially distant event because we were back in January 2021. And so the event that will be happening in 2 weeks is socially distanced. It's modified social distancing, in which the students and faculty and staff are about 4 feet apart in the arena, and the audience is at least 6 feet apart. Sold ticket seats in pods that allow families to be together. For a point of reference, though, I want us to think about what commencement looks like today and the commencement we're having in 2 weeks compared to the commencement that we have experienced at UHD. And it's hard for those who probably haven't planned it or been in those planning meetings to imagine a commencement that will be held in a couple of weeks. So I just want to share a little bit of information about it to help paint a picture of what commencement will look like. The stadium in and of itself holds about 71,500 people at capacity. At no point in time will there be more than 8,000 students in the arena. And so when we think of it, we're utilizing the entire arena, from the outside to the inside to the floor, to the third level. And so there will really be practice of social distance amongst the audience, and we will be doing it with our students to the very best of our ability. There will not be any handshaking from the president or from the dais. We will hand them a commemorative tube as students cross the stage. But we have a commitment to our University of Houston downtown students that we have promised them this ceremony. And as this is a public event, it's in the best interest of the university to move forward with this event as we have planned it, socially distanced and modified. And in perspective of the arena, there will be very few people at commencement compared to what we typically think of a commencement at UHD.
I'm sorry, how many people do you anticipate at each commencement?
I can't give you where we anticipate, but there will be no more than 8,000 people of guests as well as students in the building for 71,500 capacity.
Thank you. And then a follow-up question to that is related to social distancing in classrooms. So can we discuss that further, please?
Sure. At this point, we have not planned for social distancing, for mandating social distancing in classrooms. But look, at any given time, right, the capacity in the classrooms varies. So when you get there, and if you see that there are literally 10 seats that can be occupied, yet the classroom offers 40, please don't all sit together in a cluster. Please exercise your best judgment and separate out. In situations where it's a little bit more crowded, maybe you can't have 10, 15 feet between each other, maximize the space as much as you can whenever you can. In situations where you are standing or sitting a little closer to someone than you're comfortable with, exercise the tools that you have at your disposal. Consider using a mask if possible. And consider, if you're completely uncomfortable coming to campus, utilize the tools that you have. Consider an online class. But again, this will be heavily reliant on personal choice, personal decision, personal responsibility, and personal accountability.
Yvonne, I believe this question would be for you. Why are vaccinated individuals tasked with returning to work the day following exposure when vaccinated individuals can still contract and transmit COVID? And I'm sorry.
Actually, Yvonne, can I jump in on that one first?
Sure,
I
thank
apologize
you.
for that. All right, so yes, the situation is volatile, right? You guys know that. Delta is a different animal. We're all aware of that. When we're running things like a contact tracing program, though, I can't arbitrarily make those changes based on what I think, right? I have to follow basically a program that's been put out there by the CDC and the Department of State Health, programs that are validated by doctors, by epidemiologists, right? And currently, the current guidance on that is this: if you're vaccinated, you do not have to quarantine if you've been around somebody that has confirmed COVID, even if you've been right next to them. Okay, you do not have to quarantine, and you do not have to fill out an exposure form for us. What is highly recommended by the CDC and by the Department of State Health is that on days 3 to 5 after your exposure, that you go get tested. Now, if you come up with a positive test, we treat that as an actual positive, as a positive COVID case, right? You just tested positive for COVID, even though you're vaccinated, and it's one of those rare breakthrough cases. As far as why we can't do it on campus, it's because we don't have that medical authority, right? We follow the CDC's guidance on that, folks. Is it subject to change in the future? Yes, but it has not yet, and so I can't act on that. The contact tracing team has to follow that medical guidance.
Thank you. Dr. Masali, if a student wants to Zoom into a course that is face-to-face, is there a protocol for that?
I think that will be dependent, I think, on the student circumstance. We are, and I would like all faculty and staff to know that if a student has a COVID situation, if they are testing positive or they are asked to quarantine, We are set up through the Office of Disability Services for short-term COVID accommodations. And so we would encourage all faculty to direct their students to Office of Disability Services to determine the best accommodation that is possible. So in that case, depending on the classroom setup and the type of class and the work that is done between Office of Disability Services and the faculty member, that may be an option, but it is not something that we are sort of offering as a broad-based option for students because of the way the classes are designed and making sure that our reporting is consistent. If faculty have questions about what they can do for students in a class, they're welcome to contact me or the Office of Disability Services so that we can address that.
Dr. Blanchard, what changes does the university anticipate if Judge Hidalgo changes the status to orange? Will the university revert to remote work?
If I'm correct, and I'll ask Cynthia to help with this, but I think that we've already converted to orange.
Yes, that's correct.
And so we will just continue to follow the guidance. And obviously, I guess if the question is if we switch over, the threat level switches over to red, what precautionary measures will we take? And it will be very similar to the precautionary measures that we are already describing to you right now, but also watching very carefully in terms of what the data show us, but also the kinds of communications that we will have with the system office in better understanding the direction that the system is taking, as well as looking at higher education writ large in the state of Texas. So the reality is that we're watching carefully. If the threat level increases any higher, we're going to be monitoring carefully, but please be aware that what stands above even some of the threat level information that we get, what stands above that is state law. And so we're also governed by that which we are asked to do by virtue of state law, but also knowing that if there is going to be a need for us to make a decision, as you've heard me state earlier, to change our modality, meaning that we would have to pivot, then certainly we're going to provide you with the information in a timely enough manner for us to be able to do so. At this point, we don't project that that is the direction that we're going, but continue to stay in touch with us as we will stay in touch with you if there is a change that will come.
Thank you. Dr. Johnson, a question about laboratories. Are face-to-face laboratories at capacity? And is it possible to create some increased air circulation for long labs with a full capacity classroom?
So our natural sciences department offers the bulk of our laboratory classes, and to our knowledge, fully face-to-face labs are not capped at full capacity. We're currently offering 2 models of laboratory instruction for the fall. One is fully in-person labs, which are currently capped at 50% capacity. We also have labs in hybrid modality, which allow students to rotate into the labs such that at any one point in time, only half of the class is occupying the physical laboratory space on a given day. So faculty that wish to use fans or other mechanisms of air circulation should work with the relevant department chairs and facilities management to determine both the feasibility and the safety of doing so.
Thank you. And an additional question for you. This is from someone who says they teach online-only classes. Will they be expected to come to campus?
So Texas Code 685.010 states that an employee of a state agency, such as UHD, during normal office hours must conduct agency business only at the employee's regular or assigned temporary place of employment, unless that employee is traveling or has received prior written notification from the administrative head of the employing state agency. The employee's personal residence may not be considered the employee's regular or assigned temporary place of employment without that written notification. The governor, the UH system, and UHD administration has been clear that we will be back on campus in the fall as our physical place of work unless an individual has the approved workplace accommodations. We expect all faculty to be available to come to campus to teach any face-to-face or hybrid courses that they've been assigned to teach, to meet with students as requested and during office hours, to accept calls, receive visitors, attend meetings, engage in service, and or otherwise conduct the daily business of the university.
Thank you. Excuse me. Regarding transportation and parking, Mary, are there any special plans related to parking due to COVID concerns and concerns about public transportation?
Are there any plans for parking and for parking on public transportation?
Right.
The university does not have any plans for. We're going to continue to offer our ride sponsor program for those who do want to continue to ride public transportation to campus. That is still available. Metro is taking all their precautions as well to disinfect their public transportations as well. But we don't have any additional accommodations to be made in that regards.
Thank you. Daniel, have students, well, I'm not sure if this is Daniel or Michelle, have students by their own initiative chosen to enroll in more online courses versus other modalities for the fall?
Well, that's a difficult question because I've not pulled that data, but I can certainly get it to you. I will share that typically pre-COVID and even the last year of COVID, students have registered primarily for more online classes early. And as we transition into the last month of registration, which we are doing at this point, the majority of our students are looking for in-person courses. So it's really hard to give you an assessment of where we are today and say that that'll be final on official day. It's likely that on official day, as the majority of our students who register within the last 28 days do it in person, both the services are in person and the class modality are in person, that we would likely end up exactly where we were in previous semesters, where half of the population is looking for an online modality of some sort, and half of the population is looking for a face-to-face course. Typically, our students are not exclusive in any one of those modalities, right? So our students are taking 2 online courses, 1 in person, and 1 hybrid. And that's the options we want to prefer to give to our students because of their learning, the way that they learn and the faculty that engage with them. And so certainly there are students who would say, look, I want to take a math class in person because I find it more difficult. Certainly I do it. And so I would want to take a math class in person, but a humanities class I can take online and feel comfortable with it. So we've never pulled it out in terms of exclusive students exclusively enrolled in online versus students who are exclusively enrolled in in-person courses, because 72% of our students are enrolled in multiple modality of courses.
And can you comment on university enrollment currently?
Sure. As of this morning, we're at 15,252 students, which is about 0.6% below where we were this time last year. We are doing fairly well in continuing enrollment. We're doing well in new transfer student enrollment. We are doing well in new graduate or continuing undergraduate. We have 2 areas of concern that we're focusing on over the course of the next month, and that is new freshmen, new FTIC. Today, we're down 15%, but any given day that can range from down 9% to down 16%, just depending upon events, orientation, and alignment of a past calendar. Our graduate enrollment is down 29%, which we typically would not be proud of, but coming over the last 14 weeks, we've seen a 10% swing from down 39% to down 29%, and we're working collaboratively with the provost office and all of our graduate programs to hopefully swing that even more positive between now and then. We're confident that we see a path to 15,600 students and hopefully another historic enrollment period for the University of Houston downtown.
Tim, is it possible for someone to request fogging in their office after daily student visits?
Yes, we can. You can go ahead and request it. We'll do it as we put it together with the evening crew to fog the area. Just remember that twice a week, every classroom is cleaned with the same disinfectant that we use in fogging. Everything that you touch has been is sanitized. I think it's on Mondays and Thursdays. I can be off a little on that, but it is done twice a week.
Thank you. Cynthia, I think there's some confusion about the color we're operating in versus Harris County. Can you give us a snapshot? I believe Harris County is currently orange, but at UHD we are in green.
So correct. We're a state agency, and the state has made it very clear where they want us to be, right? As state employees, we've been asked to come back to work. And while the state is monitoring as well, right? So when we talk about monitoring, when we're monitoring, that's what you guys are hearing, right? And you're upset that that's all we're doing is that we're monitoring, and that's not the case, right? We do take a lot of guidance from the state level. We take guidance from the assistant level, and we also take information from what's happening directly around us. And collectively, a plan gets formed. Well, folks, right now the plan is that we're open, right? We're back. And we need to take personal precautions to protect ourselves and use everyone that you have available. If we want this pandemic to go away, if we want these cases to go away, if we want the hospitalizations to go away, if we don't want to lose any more family members, right, we're going to engage in this vaccination program that the governor is pushing, that the Department of State Health is pushing, that the President of the United States is pushing, that every single health official is pushing. Right? We need to get on this program, folks. It's the only way that we're going to stop this. So please help us with that, right? Please help us amplify that message. Please take that person that is still unsure, that is still nervous about it, that is still waiting. Right, what we're finding is that those folks that are on the edge, that are really just waiting, they maybe are going to do it, but there's some fear there. Right? What they're responding to is an individual person that they trust, a family member, right? A close colleague, a best friend, right? Their personal doctor. Those are the folks that are getting through now to folks that are still hesitant, right? To make sure that this is an appropriate solution for them, that this is an appropriate precaution for them. In rare occasions, sure, there's some folks that shouldn't get vaccinated, right? Their doctor will talk to them about that. But in most situations, right, we're eligible for it, and that's going to be the way that we stop it. That's going to be the way that we protect those rare folks that can't get vaccinated. So please help us out with that.
Thank you. Dr. Masali, there's a question about a standard syllabus template. Will there be a standard syllabus template as before?
Yeah, great. That's a great question. There's a new syllabus policy, and that was approved a couple months ago. And so, yes, we are working on developing standard syllabus language that applies to all classes, the ADA statement, academic honesty, disruption of services, the kinds of statements that we had for COVID. We are developing into kind of a formal shared institutional syllabus content, but we aren't developing a template, if that's the question. It won't be a specific template. Faculty are still welcome to engage their students and convey their information. All the required information needs to be on your syllabus, but we have not yet established a template. We will be sharing, as we did before, the online task force developed a recommended template, and you're welcome to use that, but at this time we don't have a mandated shared template, but we will provide as many resources as we can, and we will be sending out that information to faculty in the coming week. We'll have a website resource with all those materials.
Thank you. Cynthia, this question I believe is for you. The staff COVID exposure reporting procedure forces staff to reveal whether they are vaccinated, since the vaccinated can return to work the next day and the unvaccinated cannot. Additionally, the unvaccinated have to submit proof of a negative COVID test after they complete a period of quarantine. Is this a direct breach of Executive Order 38?
Actually, I think that question is
Jennifer.
probably more appropriate. It's more of a legal question. So Jennifer, could you help me out with that to discuss the legalities of it?
Sure. So those inquiries are being made for a public health purpose. And so under those circumstances, it is our interpretation that that is permissible.
If someone in my office or someone I've come in contact with tested positive for COVID, which means I've been exposed, do all members who have come in contact with the positive COVID person also quarantine for 10 days or just for 1 day until they provide a negative test?
So did that come through? So it's really hard for me to answer general questions with a blanket answer, right? There's a lot of complexity to determining who gets quarantined, who needs to stay home. The best thing to do is either, if you have a very, very specific question, contact me and I can give you a very, very specific answer. But every small variable changes the direction that goes in. So if you believe you've been exposed, the best thing you can do actually is fill out an exposure form, and we will address that with you in private and in a direct fashion. I will tell you this, if, follow those steps on that flyer, right? I'm gonna pull the flyer up again. Follow the steps on this flyer. If this occurs on campus, this is the worst case scenario, right? Because we're sitting at work or we're sitting in a classroom and suddenly somebody reveals that they're sick in that space. Follow these steps and you're gonna get all the assistance that you need. If you find out after work or after hours or over the weekend that somebody is ill, say an employee calls you and tells you, have them fill out that diagnosis form. If you believe that you've been exposed, that you've been around them for 15 minutes or more within 6 feet of them, and you're not vaccinated, if you believe that that's the case, then please fill out that exposure form. If you're unsure, please fill out that exposure form or write to me so I can give you some specifics. But to just give you a blanket response, it's really difficult at this point. There's just a lot of complexity now.
Thank you. Yvonne, if a staff member has used all of their sick leave, what are the alternatives for those who test positive?
So first of all, I would suggest that the staff person contact the benefits team and ESO. So one option would be the sick leave donation program. That is in place system-wide. So if an employee needs to use accrued sick leave and they don't have any, they can, again, working with the benefits team, we can seek others that may be willing to donate sick leave for that employee. Again, any questions pertaining to sick leave, contact the benefits team and we can work with you one-on-one.
Thank you. Excuse me. Could you address the reason that UHD faculty and staff are no longer allowed to work, to work remotely?
So Cynthia mentioned that UHD is now in the green phase, which means everybody's back on campus. We have 2 types of accommodations that employees can request, both faculty and staff. One of them is ADA accommodation, Americans with Disabilities Act accommodation, and the other one is FMLA. Aside from that, we want to be on campus, all faculty and staff, to support our students. So we want a vibrant campus. We want everybody back to, again, support our students.
Thank you. Dr. Blanchard, could you talk about the faculty retreat meeting next week? There was a question regarding the status of that.
Yes, I am going to be submitting a letter to the faculty indicating that for the fall retreat that's scheduled for August 17th, which is an all-faculty meeting, that we will convert that particular retreat to the virtual space. And so it still will be that we expect all faculty to attend. You'll be getting a communication that I'm working through now and will be vetting with members of the Faculty Senate, and that communication should be going out shortly. So The reality is that we're really excited about the fact that this will be our first ever fall faculty retreat that will occur at the beginning of each new academic semester. But in addition to that, it'll provide the opportunity for us to have some national guests who will be joining us that I regret the fact that you won't be able to get a chance to meet them in person, but that they have provided a rain check that when conditions are different that they will come and engage with us in person. But they will continue to be with us as well in the virtual world. So the reality is that you'll get the full schedule, so you'll know exactly what's being planned, and it will occur on August 17th. And the last piece I'll say is that I just am very excited about the lineup and the work of the faculty committee that's really done a wonderful job in getting all of this planned.
Thank you. Cynthia, can you comment on why vaccinated individuals are allowed to return to work the following day after exposure when they can still contract and transmit COVID?
So I think I touched on this earlier, right? I rely on CDC guidance on this. I can't make it up as I go along, y'all. And right now, the CDC states that on their website. If you want the exact, their website's gotten pretty large as well and is getting increasingly difficult to find. Keyword search it. But if you can't find it, please contact me, email me, and I'll send you the latest link.
Thank you. Dr. Masali or perhaps Dr. Johnson, in the past, there was a mandatory attendance policy for labs. If a student missed 2 labs, which is what they would miss if they had to quarantine, they would fail the class. What is the status of that policy? And if makeup options are not possible, what can faculty do?
That's a great question. I think that's best handled locally, so I would encourage you to talk to the department and your colleagues to determine whether that policy is still in place. That is something that is handled at the department and programmatic level.
Thank you. If a person who tested positive for COVID shared with the emergency management team all the people they've been in contact with in the last 48 hours, will those people be contacted by the emergency team and will their office spaces be cleaned?
Yes.
If you could take longer to answer the question, I can find the next one.
Yeah, no, absolutely. Whenever that happens, like I said, the interview process is pretty thorough. Right, I've got a pretty extensive background in interviewing. I used to work with the Houston Fire Department, and I was an arson investigator there. So a lot of years of actually training specific to handling interviews. But not only in the arson space, right? Do you have enough time yet?
I'm good, thank you.
All right, but also in EMS. So as far as running EMS question and answers and interviews, we're very thorough, we're very good about obtaining that information, and we follow up with everyone, folks.
With cases rising across the U.S., will there be a revision in the quarantine policy if an employee travels?
So again, we follow CDC guidance on that. Right now, the guidance related to travel is for international travel. And typically what happens is CDC puts out guidance out there, right? But it's not an automatic thing. It just doesn't magically pop into and become university policy or organizational policy. That gets reviewed by quite a few folks, right? Not just myself. I am one voice among many, right? We have folks from OGC weigh in. We have medical directors from the UHS systems weigh in. And we have leadership weigh in. And that decision to make that an operational policy for various component universities or for the system, that gets done at that level, gets sent to me, right, to implement it. So I don't actually decide or create that policy for you folks. I actually operationalize what this collective group has decided and turned into a written policy. So as of right now, we are where we are, right? It's international travel only. If you're not vaccinated, right, the guidance is really clear. If you're not vaccinated and you travel internationally, you must quarantine.
Jennifer or Yvonne, I think this is for you. What separates UHD from, or the UH system, from other state of Texas agencies who have adapted and activated the hybrid and remote work environment?
So I'm not sure I really understand the question from the standpoint of whether state agencies all are required to follow the government code and institutions of higher ed follow the education code, then we are all in the same boat in that regard. How institutions choose to implement a policy in compliance with the government code and the education code, it becomes a institution-specific and system-specific decision.
And if I may add, we are once again looking system-wide at a staff flexible workplace policy. So we're working on that. We're revising our current draft, and we should be communicating something in the next few months.
Thank you. Cynthia, are there any plans to begin monitoring breakthrough cases and including posting those independently on the web pages?
No, actually, they're not. In fact, the government isn't doing that either, the feds and the CDC and the Department of State Health. At this point, all that's being monitored at those levels are breakthrough cases that require hospitalization, right? And that's because when I've asked about that of why, right, I think the ability to control that data and to validate that data becomes more difficult if people aren't in that clinical setting. Now, if those folks can't handle it, right, you certainly cannot expect me to try to tackle that. That's an incredibly complex process. So the answer to that would be no.
Will any compensation be received for the use of home utilities during the pandemic? I believe there was a decision made on this previously. Dr. Blanchard, will any compensation?
I didn't know that was my question, but
I'm sorry, I didn't know who to send that one to. I apologize.
It's okay.
Will any compensation be received for the usage of home utilities during the pandemic? Or Yvonne?
Sure. Yes, we sought guidance with respect to providing compensation, and that cannot be done because it would be paying employees retroactively, and that's in violation of the Constitution.
Yvonne or Jennifer, you may be able to respond to this. UHD is part of the UH system, and yet UH is only going to work 3 days a week, even in August. Why is this different for UHD?
So I can address that. To my knowledge, UH is coming back to work on campus 5 days a week, beginning, in fact, I think they began Monday, a couple days ago. So all University of Houston system universities, to my knowledge, the staff are working on campus 5 days a week, full-time.
Thank you. What are the options for parents who have children who are not old enough to get the vaccine, are immune compromised, and those parents are now required to work on campus?
I suggest that employee visit with our benefits team to see if there's anything that can be done for that employee. But most likely, I cannot ADA would not, the ADA accommodation would not work in that scenario. Perhaps FMLA. So again, having a discussion with our benefits team so we can understand your situation better and be able to advise you.
How are we green operationally when Harris and Fort Bend counties are orange? Jennifer, do you want to take that?
So, and I think Cynthia touched on that earlier. Taking into account what the local authorities are doing is part of our consideration, but we are a state institution, and so taking guidance from the governor and the state health department, it also weighs into our consideration. And so it won't be always an automatic lockstep that we follow what the local authorities are doing.
Thank you. Sorry. Let's see here. We have worked remotely, Yvonne, I believe this is for you. We have worked remotely for over a year due to COVID. If the university closes due to weather, will I be expected to work remotely?
So that question came up in another forum, and at the time I mentioned that I would seek some advice on that. So we will operate, going forward, we will operate like we've done in the past, pre-COVID, which means if the campus closes for any reason, fire, flood, no water, and that has happened here before, the president will then grant whether emergency leave or emergency leave, and all benefits eligible employees will get that leave, will be at home, will not have to work remotely. We're looking at developing a protocol in the event the campus has to be closed for an extended period of time. But as it stands now, if there is a weather situation, we close the university, weather emergency leave will be granted, and employees will not need to work remotely.
Thank you. If, Yvonne, this is also for you. If my child is sick with COVID and I've run out of sick or vacation leave, can I use the sick leave pool?
So according to policy, in order for an employee to be able to use sick leave pool, they have to be out sick for a minimum of, well, for 30 days before being able to apply for the sick leave pool. So the only option might be donated sick leave. Again, we need to meet with you, reach out to the benefits team so we can advise you.
Thank you. And if elementary and middle schools move online, is there, will it be acceptable for faculty and staff to work remotely?
Currently, there is no accommodations for employees who have children that may be studying remotely. There used to be, at the beginning of the pandemic, there was the emergency paid sick leave and the emergency family FMLA leave, but those leaves do not exist currently. So as it stands now, again, reach out to the benefits team, let us talk to you, but as it stands now, we do not have any type of leave that can be offered to the employee.
Thank you. Dr. Masali, is there a plan for accommodating students going from a face-to-face class to an online Zoom class, something such as private study rooms?
Oh, so as I understand the question, it's about whether a student is on campus for a face-to-face class and has an immediate Zoom class and can't get to a private space off campus. I think that's a great question. I think that is something, as we understand the practices of the students in the coming year, we have a lot of spaces on campus where they can use a computer, and so we can look at which of those spaces are available for a private Zoom class. If they have, I think if they have headphones and there are some spaces, we can work with IT to clarify what those might be for those students. And I'll turn it over to Hossein if he wants to add something.
Just a quick addition that we do offer laptops for checkout, so students are able to go and grab a laptop and use it for a day and find their locations. And we do have several labs and spaces that may be available during those times as well. So if you reach out and we can see how we can accommodate you during that period. And that had happened in the past semester as well.
Thank you. Cynthia, I know you've already answered this, but if a student in a face-to-face class tests positive and notifies the university and faculty, will students and faculty be notified that they are at risk for exposure?
Yes, the folks that are exposed will be notified, and we talked about that process. So in order for that process to work, it's really important that you participate in that process, right? So go ahead, students, if you're positive, please fill out that diagnosis form. If you know for a fact that a friend of yours has been exposed, let your friend know that they need to fill out that exposure form. Get those forms to us, and we will move as fast as we can to make those notifications.
Dr. Masali, if a faculty member has a medical condition, a chronic medical condition, making them more vulnerable to COVID-19, can they suggest that visitors to their office wear masks, or are there any other options for that faculty member?
Unfortunately, in the context that we're talking about, I would say two things. If the faculty member has a situation which makes them vulnerable or susceptible, that may be a case of accommodation, and so certainly they should talk to the benefits team to determine if there's something specific that can be done. As a general principle, given our role as a state agency, we cannot ask people to wear masks in any of our spaces, which would include our office spaces. However, I would encourage in those cases, if students are asking to meet with a faculty member and the faculty member has that situation, there may be opportunities in the department to use a larger space for that moment or for that appointment if they know in advance and there are those spaces that could allow social distancing.
Thank you. And I believe that this is for either Dr. Johnson or Dr. Masali. If faculty teach a hybrid with a synchronous component weekly, does the faculty person have to be on campus to teach synchronously?
There is not a specific requirement about where they teach the synchronous component. However, I'll refer back to Dr. Johnson's earlier statement that all faculty are expected to be available on campus to carry out all parts of their responsibilities as needed, because we are back full-time and as state employees, that is part of our expectation.
Will new faculty orientation be held virtually?
At this time, new faculty orientation is currently planned as face-to-face, 2 half-days. The first day is in the morning, and the second day is in the afternoon.
Yvonne, what are the reasons for compressed schedules not being allowed as an option any longer?
Again, as I mentioned before, we want a vibrant campus. We want to bring life back to this campus, so we have asked all staff, as well as faculty, for the fall semester to be back on campus full-time, 5 days a week.
Dr. Masali, this is a follow-up to the question regarding office hours. Can a faculty member ask students to sit 6 feet away from me during an office meeting?
I would frame it from the faculty member's perspective. I think that we are all, if we have the space, able to social distance ourselves. So I would encourage in those cases that any individual, faculty member or not, if you're in a space that allows it, you simply can move yourself 6 feet away. And I think that is the approach that is going to reflect your individual safety sense, and then address the student needs in that way.
Thank you. This is a question regarding the law that has been quoted here a couple of times. And Dr. Blanchard, this is for you. The law that has been quoted here a couple of times says that the head of the agency can give permission to work remotely. Who is considered the head of our agency?
I am.
Thank you. Can UHD install, Tim, for you, can UHD install plexiglass barriers in faculty office desks for their office hour usage?
There is a whole series of these that were made for the provost as temporary ones that they can install. And so far in the university, we've installed about 1,500 of these. So if you need one in your office, just send it to us and we'll build you another one.
Thank you. Have all classrooms been equipped with protective plexiglass coverings around the instructors' desks?
Every instructor's desk has a plexiglass cover.
Thank you. Dr. Masali, can faculty hold office hours exclusively on Zoom, regardless of whether they are teaching online or in person?
Faculty members certainly should offer virtual office hours to students, particularly because we know that many of our students are not able to come to campus, and so we certainly encourage that kind of flexibility. However, as we indicated, if students are requesting in-person meetings with faculty, they should accommodate those and arrange that for the students.
Thank you. Jennifer, this question is asked of you. Could legal counsel please address very clearly if UHD is or is not allowed to provide permission for remote work beyond using FMLA or disability?
So is it, I'm taking this to be a kind of a flexible workplace type question. The state statute provides that the president can give permission for instances where somebody's residence can be considered their place of work. There has been analysis undertaken about the interpretation of that statutory provision and to whom and whether it can be delegated, that responsibility, and what are the criteria to make that decision. And so if there is an approved flexible workplace policy that has a mechanism in place to give approval for remote work, then the answer would be yes.
Thank you. Will distance campuses provide protective plexiglass coverings for all spaces, including including advising offices and student spaces?
I can speak to that. Yes, we are prepared to provide the plexiglass, the plexi shields in the same way at the distance sites as we are able to, particularly at UHD Northwest. We will work with the UHD Kingwood facilities to coordinate that and make sure, but I think all of the Lone Star campuses are already set up for that. They are taking similar precautions to what we are doing. So yes, if there's a question, certainly contact me or Lewis Evans, and we can work with our facilities team and the local LSC facilities to make sure that we have that.
Thank you. So I believe that we are at 11:30 at this point. I just want to remind that there is a town hall this evening for students at 6 o'clock, where we will be, a group of people will be addressing their questions. And if you have additional questions following up on this today, you can send them to coronavirus@uhd.edu, and they will be directed to the appropriate person. So thank you very much for joining us.